What are the two types of stretching? If you're paying a lot of attention to stretching right now, you're probably starting to hear a lot about dynamic stretching. Dynamic stretching is great. It is a method of preparing the body for a specific activity. So I'll just use as a soccer coach, I'll use it as an example. At the beginning of practice, I will have my soccer team do a lot of dynamic stretching. It's stretching and movement that involves stretching and trying to lengthen muscles out specific to the activity that they're just getting ready to do. If you've ever seen a swimmer standing on the blocks like in the Olympics and they're making those big giant arm swings, that's dynamic stretching, because that swimmer is getting their muscles ready for the activity they're getting ready to do for the next 45 seconds, the next 5 minutes, whatever it might be. But dynamic stretching does not replace static stretching. Everybody should be static stretching every day. Whether you're an elite athlete or somebody that doesn't participate in activity at all, you should be stretching every muscle in your body, major muscle in your body every day. So again, use as an example somebody who's sitting at their desk. You want to make sure that you are stretching neck muscles, upper back muscles, shoulder muscles, because those are the muscles that are going to get tight and pull you into positions that are going to, over time, lead to pain. So static stretching is what prevents injury and allows there to be less pressure, and dynamic stretching is what prepares a specific body part for a specific activity, but both of which are things that should be incorporated into anybody's stretching routine. So we really get to the point of why would somebody want to be stretching? Well, number one, like I said, it prevents injury. Number two, it allows for recovery. But if you're experiencing any stiffness, any soreness, any pinching, any tightness, any popping, any cracking, that's a sign that either the pressure on a structure or inside of the joint is too great, or that the muscle isn't allowing a part of your body to move the way that it should. So what we need to do is make sure that we get you on a stretching program that's specific for you. As part of a physical therapy evaluation, we're going to look at specific movements. We're going to look at how you're doing things, and we're going to apply what needs to be stretched to your specific condition, as opposed to you go onto the internet and you've got a hip problem and it tells you should be doing an IT band stretch. Well, that might be a stretch that you need to do, but the question is, what's really causing that IT band to get tight? That's what else needs to be stretched, and that's really where we would come in as expert physical therapists. So again, stretching, something everybody should be doing all day long. Make sure that even if you're, again, not an active person, stretching should be a vital and an integral part of your day, because it will put you into that category of 60% of the time it reduces the possibility of stress, strain, pain, stiffness, etc.